This is in connection to morning after pills and the regulation that came with it. In fact, the access to morning after pills or emergency contraceptives could get even more complicated, Vedant. Women may soon need a prescription to get these emergency contraception. This could be a significant barrier to getting access to over-the-counter contraceptives taken within 120 hours of unprotected sex to prevent pregnancy. There has been significant backlash to this move, Vedant. Of course, debates, going on as far as both sides are concerned. Many, in fact, supporting this ban and many against it as well. Central Drug Authority saying irrational or excessive use of these pills could have significant health ramifications for women.
Absolutely, but what do really top gynecologists think about it, given the fact that this is an extremely important issue? The government mulling this very, very seriously. The Central Drug Authority saying that, there has to be a sort of a mindful use or restricted use of, these contraceptive pills. But let me bring in my guests this morning. In fact, Dr. Archana Dhawan Bajaj, a senior gynecologist who's associated to Apollo Cradle and Fortis Hospital, is with us. Also, Dr. Anuradha Kapur, Principal Director, Obstetrics and Gynecology and the Head of Unit Max Smart Super Speciality Hospital, Saket. Thanks very much, Doctor, for being with us. Dr. Bajaj will also be joining us shortly. Dr. Kapur, what do you think of this move, given the fact that there has been, been a long drawn debate whether there should be easy access to emergency contraception or not? Many see this as a regressive move, given the fact that there should be sort of easy access to contraception. This is something that is a woman's prerogative.
Yeah, but what is happening is, what I've noticed in my practice is that patients are misusing it. They're using it randomly. What happens is, this is a progesterone. So once they use it, they have a little bit of bleeding. They think this is their period. And then they come to us with advanced pregnancies. The other thing is also that, this causes a little bit of irregular bleeding and spotting. And patients don't understand that if they keep having this irregular bleeding and spotting for more than 3 weeks, it could be a sign of an abortion, or it could be a sign of an ectopic pregnancy, which can be very serious for the patient. So since emergency contraception is something which is supposed to be used once in a few months when there's actually been a failure, the condom is ruptured or they've forgotten to use it. But patients are misusing it. They're using it every time they have unprotected contact. They're using it. This is causing a lot of irregular bleeding. They're not understanding that it's playing havoc with the body.
Ma'am, I just wanted to ask you, of course, you're talking about health complications, but what I wanted to ask you is that not many women are unable to, are able to consult doctors in a timely manner, one, and also, this could lead to more illegal and unsafe abortions and unwanted pregnancies. That's the, argument as far as the other side is concerned. So don't you think it could lead to unsafe abortions, unwanted pregnancies as a result of them not being able to access those pills on time, as a result of them not being able to consult a doctor for that prescription?
First of all, my argument to this is that there have been lots of studies which have shown that despite emergency contraception being available, it has not really reduced unintended pregnancies or induced abortions. That is one thing. And for me, I think safety of the patient is more important. And if they want, because patients are not aware that if they take it repeatedly, they can land up with ectopic pregnancies or they can have advanced pregnancies, because they're not really aware about all the side effects. And so it is always better. I think patient safety comes first, and they can access. It could be either a general practitioner or anybody locally in there, but it has to be a doctor's prescription who can explain to them the side effects and the fact that if they're bleeding continuously for 2-3 weeks, it could also be a sign of ectopic pregnancy. So they have to report back to the doctor. Okay. So I think that is very important.
Dr. Bajaj, come in on this point, because what Dr. Kapur seems to suggest is that they are emergency contraception or emergency contraceptive pills for a reason. The usage has to be such as well. There cannot be this sort of excessive use that, as Dr. Kapur points out, we see these days. The focus should be on preventive measures, and the awareness should be more about that, instead of, perhaps advocating for, emergency contraception.
Greetings of the day and a happy Vijayadashmi and Ashtami to everybody. At the outset, I'd like to emphasize that, of course, there is nothing to undermine the use of a prescription. There is nothing to undermine the necessity of a regulated medical practice. But saying that this exceptional circumstances, or rather the overwhelming circumstances in which emergency contraception is mostly required. And here I'm particularly emphasizing those episodes which happened out of a consensual sexual act. So we're talking about molestation, rape, etc. And we're also talking about young children, unfortunately, who have promiscuity in their lifestyle and are having exposure to sexual acts unplanned and unprotected. So for this set of people to actually go out, start looking for a prescription is going to be so overwhelming for several social reasons. And this is the set of people where emergency contraception then becomes utmost important. Of course, I do agree with Dr. Kapur that the possibility of an ectopic, advanced pregnancies, irregularities, etc., etc. But if we were to take the basic focus of emergency contraception, where these two circumstances become so important that you do not expect a young girl to go actually out of the box and start finding a prescription, and by the time she actually gathers the guts and does it, the need, the time, and the efficacy of taking the emergency contraception is over and done with. So with that in mind, I feel that there has to be something which gives a leverage to allow emergency contraception to people in exceptional circumstances.
So that's something that I wanted to ask you, Dr. Bajaj. Are there any alternative safeguards you'd suggest instead of a prescription requirement to address concerns about misuse?
Absolutely. And, herein the role of trying to educate people, trying to bring across enough awareness comes in. If you're having a pill or a medication without a prescription, you have to know when, how, where to draw the line, when to actually access it. And this is where the role of people like yourselves in the media, of us as healthcare provider comes in. And of course, the government comes in because, unfortunately or fortunately, as the society is advancing, we're also moving towards a trend where younger children are sexually active, where there is so much openness in the society that these kind of acts are going to happen, and we are going to have people needing access to this medication, unfortunately, sometimes even without a prescription. So unless there is a fair amount of awareness, there's literature available, there is information flashed across different portals to get to the younger generation, social media, etc., this act can never become, never have the importance that it needs.
In fact, Dr. Kapur, coming on this point, while we speak of awareness as well, something that has been a contentious aspect as far as this entire debate is concerned is that the physicians have a certain amount of bias against emergency contraception. Where does this really come from? Because we have seen, of course, a lot of misinformation, but more often than not, doctors do advise against emergency contraception, which is why many say that there is a sort of this physician's bias against contraceptive pills.
No, physicians don't have a bias. Obviously, if it's needed, it's needed. Why should we have a bias against giving emergency contraception? It has to be taken as soon as they have an unprotected contact. So we don't have a bias against that. It is just that we have a bias against misuse and repeated use. It is an emergency contraception which is to be used once in a few months when you've actually had an emergency. But if people are taking it repeatedly every week after every unprotected contact, that is the problem that we have. So that's why we want. So I think the via media is, if you give it over the counter, because Archana also has a point, I also have a point, and this debate has been going on for a long time. The via media is that if the pharmacy is giving it, then they have to give a leaflet. The government has to provide a leaflet explaining all the side effects, explaining the risk of ectopic pregnancy, explaining the risk of having, that little bit of bleeding, which is actually not a period, it is just a withdrawal bleeding, and that you can come back with an advanced pregnancy. So if all that can be explained by the pharmacist, like it is done in the UK, the pharmacist is very, very responsible and they explain everything. So if that can be done and there can be literature provided with every tablet of iPill that we are given, that is the only via media. Otherwise, if you're giving it over the counter and we're not explaining anything to me, I think that is a very unsafe thing. But obviously, the other counterpart is that we have to make it very accessible to patients, like Archana said. So I think this is the only via media, that there has to be education. Obviously, TV and media and all, but with every pill that you give, the pharmacist has to explain, and there has to be a leaflet saying that these are the precautions that you have to take, and report back to your doctor if you have untoward bleeding for more than 2 weeks, or if you have pain, or if you have a fainting attack. If all that can be explained, you can, maybe that could be the vial media. The government has to decide that. Otherwise, it's getting, what we are seeing is in our practice that every day patients are coming with either an ectopic or advanced pregnancies because of the misuse of emergency contraception. So I think my viewpoint on this is that there has to be a lot more education, and with every
All
pill.
right. Thank you, Dr. Bajaj and Dr. Kapur, for giving your perspective on this important discussion. Of course, we have opposing views here, Vedant, but very interesting. What both of them are, in fact, agreeing on is the fact that there has to be more awareness, education as far as consumers are concerned, women are concerned. They should be made aware of the need for it, and also perhaps the side effects as well, so that they can take an informed decision.